it going?
Good, yeah. Hello,
Good.
welcome
Hello.
back to another episode of Physio ireannLive.
What episode are we on?
8, 9?
8.
8.
Eight.
Okay.
Ollie's back.
Hello, good to be back.
Good to be back. Okay, first question is, my daughter suffers with deep muscle spasm in mid left hand side / back. She describes it like a massive tightening and has severe pain with it. Can't cough, sneeze, breathe deeply with it. Okay, so when she coughs, sneezes or takes a deep breath, she's getting pain deep into her side. She is pregnant, so can't take anything. It's a two-part. What do you think it is? And any ideas what she could do for it?
Right, so there's a few things that we're thinking of that it could be. The most likely one is that it's just pure muscle cramp, that the muscles are tightening, and that is generally not anything serious. So if that one, you can definitely treat it and do things about it. But there could be other things, so it's always worth getting it checked out by a professional, going to your GP, and just making sure that it is purely muscular, and from there then you can start to try and address the tightness and that spasm that you're getting. So if we'll go with it is muscle spasm and tightness, the things which cause it, first of all, would be dehydration. Sometimes if the muscles aren't getting enough fluid into them, they can start to become a little bit tight and go into a spasm. Also, as we are pregnant, we start to get a bit heavier, so it can sometimes be that additional weight that the muscles aren't really strong enough, are used to holding, and then what happens then is those muscles become overloaded over time and they just start to get tight and go into a cramp as well. And then the other thing that can cause it is due to mineral imbalance. So if you're not having the best of a balanced diet, which can be hard during pregnancy,
or if you're sick during pregnancy,
to keep your food down and things. So it's trying to make sure that you're eating and getting enough nutrients and vitamins in. And if you're not, then maybe looking at supplementing, not going over the top, but again speaking to the doctor about some supplements, maybe if you're struggling to keep your food down. So that's looking at from a mineral point of view. Fluid, again, it's just about increasing the amount of water that you take in on board, and then from a muscle tightness point of view, then you're looking at trying to do some stretches. So the stretches that you'd be looking at doing would be some simple thoracic stretches and lower back stretches. So Googling lower back stretches, rotation stretches, even sitting, folding the arms, trying to twist and just pulling the elbow around to try and get that left side a little bit more stretch. You can do ones where you're standing in a door frame. You can Google door frame where you're holding onto the left with left hand up on the top of the frame, and you're leaning to the side. You can do your cat and camel stretch that we do in Pilates, where you're sitting, you're in 4-point kneeling, and you're rounding your back up, arching it down, and you can do a really nice stretch in the child's pose position, they call it, where you're sitting right.
Pregnant shit.
Yeah, sitting down onto the heels, and you're again leaning both hands over to one side. So you take both hands right over to the side and sit back and lean over to the other side. So you're just trying to open up that space as much as you can to try and get a good stretch going on it. Other things that you can try are putting a heat pack, so getting some nice heat in around there, so a hot water bottle or a wheat bag in around that area, or even just soaking a nice hot bath with some Epsom salts, just to.
When you're pregnant, I think with pregnancy, the stretches are good, but it might be an idea to actually get an assessment. What Ollie's suggesting is we would absolutely do, especially in the early days or if you're not pregnant, but sometimes when you're pregnant, those positions are difficult because of the size of the bump.
Absolutely. So
we're not too sure how far along this lady's daughter is. If their bump is bigger and you're struggling with some of those movements that Ollie showed you, it might be worth just popping into your chartered physio for them to first of all assess, because then they'll be able to pin down what you're saying, and then be a bit more specific.
Yeah, absolutely.
With the stretches to try and help, because the coughing, sneezing, deep breathing, that really does sound like muscle spasm.
Yeah, it's just really, really tight.
And sometimes too, depending on how big they are, the positioning of the baby can irritate up underneath the rib cage. So yeah, it's a tricky one. I think definitely some stretching, but maybe get it double checked because of the fact that they're pregnant, and make it a bit more specific.
Absolutely.
Anything else I could do? Keep active, don't sit for too long. You know,
stay in one position for too long. Yeah, it's good.
Back to the advice that we would give, you know, for any of the mums that are having a little bit of back pain or rib pain, is to try and make sure that you're changing your position regularly. If
you're sitting on the sofa, try not to keep taking the weight down through that left side if it's already tight. If you're actually getting support from there, it's just going to tighten those muscles a little bit more as well.
I wonder would external support, I don't know, because of the rib cage, you know, things like maternity belts and that, again, depends how far gone they are.
And it depends how far up.
Yeah, far up the pain is.
Yeah, if it's going further up the ribs, it's not going to be too much of a
But
support.
if it was further down, then you could, again, your healthcare professional will be able to advise you on this. You could.
I was looking at glutes as well, because the glutes can be quite tight as well.
Right. Yeah, it's like you said, if they're not tolerating the increased load that comes with being pregnant, then your strength work actually might be the key thing to start with, as well as the stretches, and that would require you to be assessed and given the appropriate stuff rather than just googling what you can do. Again, just because of pregnancy, we change things around a little bit differently. So,
and it is important that I know you're carrying, obviously for the 9 months, but then after that period, then you're going to actually have to physically carry the child as well. So you want to try and get it sorted as soon as possible, rather than letting it go the 9 months thinking it's just going to disappear afterwards, because often what we would see is people actually get an increase in aches and pains after they deliver, simply because like that they have a new weight depending on the size of the baby they deliver, obviously. But they're putting it into all these awkward positions, getting into car seats and things like that, and it just puts a lot of stress on the back and on the muscles around the area. So
I think though, neither of us are worried by that message. Neither of us read it and thought, oh god, there's something serious going on here. Like, it does sound from the symptoms like something that is mechanical and muscular. So maybe try some of the things that we suggested, and if it doesn't settle, then get it checked out.
Absolutely.
All right? Hopefully that helped. Okay, another one in here. It says, hi, broke my right elbow years back, having a problem with my hand, things keep falling from my hand.
Okay, so there's a few things going on here. I guess, what's causing you to drop it, really? I mean, is it just pure muscle weakness that's causing it, where the muscles aren't strong enough to physically hold things? Is there a neural component to it? Have you damaged your nerve, or is your nerve starting to become pinched or trapped at the moment where it's not allowing the muscles to fire? Are you getting any other symptoms with it? Are you getting any pins and needles or numbness with it as well, which would again lead us to go down that neural kind of pathway? Yeah,
so there's some kind of weakness going on, isn't there? So if there's no numbness, pins and needles, tingling in the hand, then we're probably less worried that it's a neural component and we're just a muscle power component. But if you're getting the tingling, the pins and needles, then there could be something a bit more neural going on there. I think either way, you're probably not going to go too far wrong by strengthening this arm. Right?
Definitely, yeah, I would definitely look at strengthening up.
When we have a broken bone, no matter how far back in the history it is, it does affect the joint itself over time. Would you agree with that?
Absolutely. So,
so if we have a fracture in our younger days, and it could be even when you were a teenager, then as we get older, that joint is a little bit more affected by time than a joint that hasn't had the trauma.
So breaking that down, that means that you're going to get arthritis or you're in that joint. Than you would if you didn't have a trauma in the joint.
Previous trauma is an indicator for getting arthritis earlier if you haven't. And then if you do get arthritis in a joint, then it affects the power around that joint. So if you're dropping things and you're not getting the pins and needles and numbness, I think going down a strengthening route, you're not going to go too far wrong. So what kind of things could you do?
Again, it depends on, like, So it's gripping, or is it
well,
more
it says
wrist
I have a problem
extension?
with my hand, things keeping falling from my hand. So yeah, it sounds like it's a grip strength.
So gripping, so purely gripping. So again, the simplest thing would be to get like a sponge ball or that stress ball, holding onto the stress ball and setting yourself some like a minute on the clock. Squeeze, hold for 3 seconds, let it go, and do that solid for a minute. Have a rest. You'll feel your forearms start to get tired eventually, and then you want to do that about 3 to 5 reps to really try and get those forearms working nice and hard. You can also get a basin of water, which is really good. Get a face cloth, and you want to soak the face cloth in water, and you want to start to wring the face cloth as hard as you possibly can. So you're gripping, you're squeezing, and you're also twisting. So it's a really, really good one, and that really does start to fatigue. And you want to again you can set it on the clock, set yourself a minute where you're really squeezing it and wringing it as hard as you can. Another way to see what the strength is like in the left side compared to the right side would be like that. Get a sponge or get a cloth, soak it in water, hold it up, squeeze it as hard as you can. When you feel you've got it squeezed as hard as you possibly can, pop it into your good hand and give it another squeeze and see how much more water falls out, and that'll give you a good indication as to actually, Jesus, there was a lot of water left, that this arm is quite weak. So it's
a good way of seeing if you're getting somewhere with your strength and exercises as well. So if you're dropping things from your hand, grip strength work like that is perfect. And you can even Google grip strength exercises, but in clinic we would normally start with something like Ollie said, squeezing it, increasing the time. Then we might get them to even hold a weight in the air and grip it. You might even start with like a can from the cupboard. Yeah. Hold it up and grip it for as long as you can.
Small bottle of water, anything.
You'll feel the pressure in your forearm, and then you can step that up into a heavier bottle of water, a pint of milk, holding and well, maybe not a pint of milk, that's a bad example. Heavier objects. So we would
Ladies'
normally
handbag, always heavy, never fails.
And you grip a handbag though, handle maybe. In clinic, we would normally use weights. We'd go from half a kg to 1 kg to 2 kg to 3 kg and so on. But definitely that you need to get that addressed, because if you're finding that now, you don't want it to get any worse. So grip strength exercises is what we'd recommend in that situation. Now, if there's pins and needles or numbness, then it's a different situation, and we would probably suggest getting that assessed so we can check to see where that's coming from. So any altered sensation, or if you notice that you're struggling with fine tasks like buttoning shirts, handwriting, again, we would advise that you get that checked. The usual story here in Ask Physio, and if in doubt, get it checked out. But if it's just that you notice that you're dropping things, start with the strength work, and if it doesn't start improving, then get it double checked.
Yeah, good.
Alright, hopefully that helped. Okay, so we had one last week that we want to just jump back to. It was about cramps. This person said that they regularly get cramps in their legs, and their question was, what is it and what can they do to help it? Do you want me to?
I think I've done more than enough this week.
Well, you had a few weeks off there. We get asked this question an awful lot about leg cramps. And it is a tricky one, because there's no simple answer for leg cramps, and you know, the GPs, if there's any out there listening, they might find the same thing, that patients often complain of leg cramps. I think when we take a step back and look at, so what we're talking about here, leg cramps, if you know, some of us probably experienced a muscle cramp at some stage. It's where the muscle really tightens up, can be really sore, and you have to try and get it stretched out in order for it to calm down.
An involuntary muscle
contraction. Often happens at night time when people are in bed, and it'll wake them up, and people struggle to sleep with it. They have to get up and start walking around. So muscle cramp can happen for several different reasons. The first, and you know, maybe the most common reason, is as a result of muscle fatigue. So this is when you've done a really heavy session, or done exercises or movement or strenuous activity that your muscle group are not used to. So I know after I did those long runs that I did for that Brighton Marathon that I trained for, God almighty, that night my legs would just, even if I went to bend my knee, my hamstring would cramp and I would be screaming. So, but that was a direct result of me pushing my muscles to the end of their capacity. So for patients who maybe were out gardening all day for the first time of the season, or you went on an extra long walk, or you found yourself, you know, busy tidying up in preparation for something happening in the house, and you're cramping that night, that's probably a muscle fatigue issue. And often some stretching, and then in a few days that will calm down and it will all settle down. Another common reason for cramp is to do with circulation. So this is where the muscles are not getting adequate blood flow, and we're talking at a micro level here. And that will happen to patients who might have a history of cardiac issues going on. So, you know, who might have had stents fitted, who might have a history of cardiac surgery, who have basically narrowing of their blood vessels. So the blood struggles to get to the tiny little vessels that innervate the muscle. And you'll find at night time they're up walking around, and their cramp is often eased by movement because that increases blood flow and reduces the cramps. That's a very hard one to manage long term. It's one that you probably need to speak to your GP about because it's usually a medical management. I mean, you can get up and move around and that will give you relief short term, but it's usually a circulatory issue that they'll look at different types of medications for and things like that. It's definitely beyond our ability to answer what that is, but it's worth talking to the GP if you have a cardiac history and you're getting cramps. The other thing is dehydration. And again, if patients are come back from holidays and they've been to a hot destination, it's like, God, the cramp was killing me. And that is where, again, the muscles just aren't getting enough fluid intake and it's causing cramp. So, and the dehydration can link to where some of the essential minerals or nutrients the muscle aren't getting either. So things like magnesium and potassium, if you're dehydrated and your muscle isn't getting them, then you're more prone to cramp.
Tonic water isn't very good for the cramps. It's got quinine in it. Quinine in it. Yeah, which generally the GPs or the doctors for people with heart problems would generally prescribe quinine or quinine, I'm not sure how you pronounce it, for muscle cramps and muscle spasm. But it does occur naturally and freely in tonic water. The gin, whether or not the gin is necessary, it's debatable, but it's no harm, I think, including the gin in the tonic water.
That's a joke. We are not recommending gin and tonics for cramps. Okay, so that's why they say the tonic water.
Yeah, tonic water. Yeah, it's not just a myth. Actually.
So that's the potassium and the magnesium.
But it's got quinine. So quinine is a natural mineral.
You could supplement too, probably from a health food store or something like that. Again, you can chat this through to your GP.
Advice, before just going taking.
Yeah, absolutely. But I guess it's been aware that dehydration or changes in those essential minerals can increase the risk of cramp.
Regardless of the causes, so regardless of whether it's dehydration, muscle tightness, lack of blood flow, or mineral imbalance, either way, you need to stretch the muscle, all right? Because the muscle is already tight. You need to keep stretching it. So if it's your calf, you need to be doing some calf stretches. If it's your hamstring, and again, just Google this. Google the stretches. Really, really simple, really, really easy to do. But it's doing them a few times during the day to try and set yourself up so that your muscle is starting to get a little bit longer, and it's not as easy for it to go into that cramping state, which you do get in that life.
So if you find that it's a particular muscle group that's cramping on you, so if it's the front of your thigh, just quickly Google stretches for the front of your thigh. If it's your hamstring, Google stretches for the back of your leg. Calves is another one that cramps regularly. So when our patients come in complaining of it, we send them home with the wee exercises to stretch out the muscle to try and reduce the cramp. So I think there is a few reasons there. It can be very frustrating and painful, particularly if it's keeping you up at night time. So have a think about those things. Maybe go back to the doctor and talk through the options and see if you can try and reduce your cramp.
And one other thing, just really quickly, Physio has an important birthday.
No, we're done.
So
you're hanging me.
We're not saying any ages or anything, but it's Kira's birthday next week. So if you see Kira in passing, just wish her a happy birthday. She's absolutely embarrassed by it.
I am.
But,
it's not a good birthday.
I'm gonna have a nice big bruise in my arm later.
Can't believe you did that.